watch, and that includes the family of the late Thomas Eric Duncan. And our chief medical correspondent, Dr. Sanjay Gupta, joins us with now more on what we should watch for. So we're over that first hump, at least for this group of people, that could have been an alarming rate of people perhaps with it. We don't have that. Who's next? I wanted to get the all clear.
So there were sort of three phases. Remember, he went into the hospital once, he was sent home, went back, during that time period in between, he was with his family. So it was the first group of healthcare professionals, the family, and now there's some 76 others who so far look like, beyond these two nurses that we've talked about, that don't seem to have any symptoms. So we're waiting to hear about them as well. And that's important, obviously, for their health, but also because that hospital, Robin's sort of been on diversion, meaning they've sent patients away because they don't have enough staff. They got to get those people back to work at some point as well. So once that happens, I think you're going to see a little change in tone from Dallas.
Hey, how do you feel about the announcement about our strike team, a quick response strike team who, when we have someone be diagnosed with Ebola in the United States, they will go in and supposedly they're the experts?
I think it's a good thing. On one end of the spectrum, you said, let's just send all the patients to the Emory's, the NIH's, the 4 facilities. I thought that'd be hard to do. I mean, what if we have a lot of patients? On the other end, it's just these hospitals sort of fending for themselves. This seemed like a good compromise to me. The hospital can still take care of the patient, but the strike team comes in. They do, everything from showing you how to take on, put off your gowns, your protective gear.
Or they're watching, observing to make sure, right? Because you can be told one thing, but then when you've got all this stuff and you're trying to put it on, you actually need observers.
I think so, and there's parts of your body you can't see exactly, so someone to really observe everything about it, who've done it before and who have a track record of success. You and I talked about this before, but they've done this for so long in the middle of jungles, literally in Central and West Africa, where they set up these tent hospitals, and they've been able to do this successfully. So the idea that we could do some of those same things at a big hospital in the United States seems pretty obvious, but the training is necessary.
This morning, I think it was Nigeria, was just declared Ebola-free, which, that sounds like, ta-da! Really what it only means, correct, is that they've gone 42 days without a new case. But why is that significant?
So, we talk about 21 days being the incubation period. 42 days is 2 incubation periods. And that's what public health officials use sort of as the sign to say, now it's all clear from a community or a society or a country standpoint. 21 days for an individual. But if you don't see any new cases over 42 days, that means you can give the all clear. It's good news. I mean, look, it's worked in Nigeria. It's worked in Sierra Leone. They've given us the all clear there as well. So the fact that this can work is there. They just have to apply some of those same things to other countries.
So supposedly in a few minutes here, we're going to see a news conference out of Dallas. What in particular will you be listening for, and what should we listen for?
There are so many lessons to be learned from what happened in Dallas. I think, look, if this had happened in any other city across America, I think they could have fallen into some of the same problems Dallas had. So the question is for other hospitals out there and everyone else, what did we learn in Dallas? What can we apply to any primary care hospital, ER, anything in the country so that these same mistakes don't happen again?
Really quickly, there are some kids from Oklahoma who are on the same cruise as somebody who handled the lab samples from Thomas Eric Duncan. That person tested negative, correct, for a fever. I think a blood test came back negative. So is it just precaution or caution above and beyond what should be that these kids are being told? Don't come back to school just yet.
They're not at risk. They don't have Ebola. I mean, it's one of those things where you don't want to dismiss the fear. I mean, you can understand why the fear is there, but they're not a threat to anybody in that school. They're not going to get sick themselves. So it's a abundance of caution, but really not necessary scientifically.
Right. Well, man, I just hit you with a lot of questions, and you had an answer for all of them.
Maybe a little bit more good news today than in days past.
Yeah, good point. That would be the headline. Thank you. So we do have that press conference coming up, and he'll watch it, and we'll take you there live as well. Police have called off the search for a missing college student